I'm going to talk about my career and interesting aspects of my job as a biomedical engineer in a hospital. And but I wanted to talk about risk management. And you might say, well, why risk management? I think that this whole concept of safety and risk is maybe one of the most important concepts for the biomedical field, particularly related to the hospital, because for many years we didn't really think about patient safety. We just thought that physicians are very competent, people in the hospital are very competent, the patients are in their hands, and everything will be fine. But that wasn't particularly true. Medical equipment maybe have been designed, not the best, or it may have been maintained not as it should have been, or the users may have used it without the proper training, and therefore the safety in the use of equipment wasn't what it should be, or the risk of possible injury was very high. So as a biomedical engineer in a hospital, I thought a lot. And as a matter of fact, the whole organization thought quite a bit about how to be safe. We had a safety committee. We had a risk manager in the hospital. We put a lot of effort into reducing risk and increasing safety. And actually, and it's pretty interesting, I think that this concept applies to everyone, particularly biomedical engineers, particularly engineers, but biomedical engineers as well, whether you go to work for a manufacturer, or you go to work for a distributor who's supporting equipment, or you go to work for a hospital who is using equipment on patients. You need to understand these concepts, because this could be one of the most important things in a young engineer's career is to understand this well. So let's talk about it. So safety and risk, it's like the opposite. They're the opposites. High safety means a low risk, or high risk means low safety. So they're the opposite sides of the same coin, you could say. So if the risk goes up, then safety goes down. If the risk goes down, then safety goes up. Everyone loves safety, but nobody likes risk. Therefore, we have a risk manager in the hospital who manages the risks of providing healthcare to patients. So safety is the level of risk that you're willing to accept. So if we create a safe environment, it's not a perfectly safe environment, and there are always some risks. So it's what level of safety can you tolerate? What level of risk are you willing to accept? And safety is freedom from danger, risk, or injury, but there's no such thing as perfect safety. And safety is very subjective. So, I might say, oh, that looks very safe. And somebody else might say, oh, look at all these problems that exist with this situation, or this piece of equipment, or this environment. So it is subjective. So as engineers, we're systems thinkers. People who are not in engineering don't think in a methodical, organized way. They think in a way that maybe is artistic, or maybe is inclusive, or whatever other types of people do. But as engineers, we're very systems oriented. So we don't like subjective things. So we try to categorize risk and categorize safety. So I'm going to try to cover that a little bit so you can get an idea of how we look at risk in a scientific methodology. So risk is the possibility of suffering harm or loss. So is this a high risk environment, like mining, or farming, or working on the docks? Is a high risk because it's possible to suffer harm or loss. Absolute safety is generally not achievable. These are principles. Zero risk is generally not achievable. Now, but we can spend money to get the risk lower. We can put effort in to get the risk lower, but it has to be a balance. We can't spend $1 million lowering the risk because we don't have $1 million. So, so we have to balance between safety and a utility. That's what we can do and what we can't do, how much effort, and then resources, how much money, how much time, how much effort. But we want to reduce risk, so we try to put as much effort into it as smartly as possible, making decisions. So optimal safety is not an automatic byproduct of good overall intentions. So back in the day, many years ago, physicians were the best of society. The smartest people went on to medical school and worked in the hospital, and the nurses were very conscientious. But putting those people together didn't automatically create optimal safety. So the bottom line is it requires a very specific effort. So we're going to learn a little bit about that. So risk management identifies the risks. It analyzes the risk data and mitigates, that is, tries to reduce the risk. That word mitigate means reduce. So we're going to talk about this whole process. And then safety programs manage that risk through education. So perhaps you, in school or in some work environment, the safety department taught you about fire safety or electrical safety or other things. So we educate people to increase safety or reduce risk. We do more maintenance on equipment. The reason we do maintenance is so that the device won't break when it's being used. So we do maintenance, but you can do major maintenance every day, and at some point it doesn't become cost effective. The increase in safety becomes so small, with added maintenance. And in fact, at some point, going in and doing maintenance too much maybe even increases risk, because you may disturb things that should not be disturbed when you do maintenance. So there's a good balance in there somewhere. We also design things that are safe. And we put on personal protective equipment. Like in this day of the pandemic, we're all wearing masks. That is a risk reduction technique. Social distancing is a risk reduction, or it increases safety by staying a distance from people. But in the hospital, we also have surgical personal protective equipment. In the lab, we have different personal protective equipment. So risk management in general, here's just a definition. It's an organized effort to identify, assess, and reduce, where appropriate, risks to patients, visitors, staff, and organizational assets. So we worry about patient safety, but we also worry about damage to the equipment that we spend all this money on, or damage to the reputation of the hospital. The hospital's good reputation in the community is an asset. Public relations, so we want to be careful that we don't damage that as well. So there's all sorts of ways to look at risk. That's why there's a risk manager, and yeah, okay. So the history of risk management. So risk management really was not really a science until the insurance industry began to use it many years ago. They adopted a methodology to look at risk. And thereby, if there was a high risk, they would increase the insurance rates, and if there was a low risk, they would decrease the insurance rates. And that's when risk management started. But then eventually, every organization and every business has risks, and they must manage them, particularly in hospitals. The risk management in healthcare is a big deal. It's very important. And healthcare providers, that is hospitals and healthcare organizations, need to address this, and also medical device manufacturers, and also medical supply companies, medical supply manufacturers, all need to look at the risk of their products, the risk of the use, accuracy of the instructions, the training materials, so that in the hospital, the risk is reduced, the safety is increased. So what do we do in clinical engineering? So this is a clinical engineering course. So let me tell you specifically what clinical engineers do to manage risk. Sometimes the manufactures something, sells it, puts it out there, and then they realize that maybe the capacitors in the batch that they got from that manufacturer to install in their device weren't good, or the integrated circuits weren't correct, or so they recall the device and they make modifications, and then they give the device back. So managing recalls is a risk management technique. If we just ignored it, we would have equipment out in the hospital that had problems that didn't get fixed, that we didn't know about. So by paying attention to recalls and managing it, it's a good risk management technique. We keep track, we have an inventory of every medical device in the organization, and we keep track and we report which devices are being maintained, which devices maintenance is overdue, which devices have failed more often, which devices are being reported as not working, but the technicians can't find anything wrong, so it may be a user problem. So we track the equipment and we report to the safety committee. We look at medical device accidents or incidents, and we investigate them. That's managing the risk, so that we can learn from what happened, and we can tell others about what happened so that it doesn't happen again. If we make a mistake, everyone makes mistakes. It's no problem. We shouldn't be embarrassed by making mistakes. We shouldn't criticize people for making mistakes. However, as an organization, we should prevent that mistake from taking place in the future. So if the same mistake is made the second time, then there's a problem. Maybe made by a different person, and the organization knew about the problem, and if they don't address it so that all the rest of the staff know about this potential problem, then that's a risk management technique. And medical technology, we have some technologies which are inherently dangerous, like MRIs have these huge magnetic fields, and lasers can put out an eye from across the room. And anesthesia, the equipment uses gases to bring the patient real close to death as possible, so that we can do surgery and they don't move, or they don't realize it. And then when we're done, we bring them back up to consciousness. That's a dangerous process. So we would want to particularly focus on high-risk devices. And even just not, buying parts. Sometimes our car needs an air filter or an oil filter changed, and we go and buy one from the local parts store. Well, that's not the part that the manufacturer provides, but it might be perfectly okay, and we'd use it, and maybe it's perfect and maybe it's not. But in the hospital, we do the same thing. We buy alternate parts, and that's a risky business, so you want to be able to look at the vendors very carefully. Even things like electromagnetic interference, that's EMI. Electromagnetic interference is the radiation, the electromagnetic radiation one device gives off from its electronic circuitry might interfere with another one. We have this problem in the operating room where an electrosurgical device, which cuts, it's a knife, but it's an electronic knife, and it generates a very high frequency current, and that electronic circuit board that does that is radiating this electromagnetic interference into the environment, and the bedside monitors, if they don't have the right filters, or if the electrosurgical unit is not shielded appropriately, one device interferes with another. And even things like disposing used equipment. These all have high risk. Disposal of used equipment, the equipment might be contaminated. It might be radioactive. Excuse me. It might have patient information on it that we don't want discovered on the computer. And so we dispose of it in the dump, and then somebody finds a computer and they pull it off and turn it on and sure, hey, this computer works and it has all these patients' information on it. That's high risk. So now let's look at the scientific methodology we use to analyze risk. And we do this by looking forward in time. Risk management is something that we look at future events. We say, well, here's the environment that we have now, and what can we learn about this, and how can we make it safer? If we look at things that happened in the past, that's like an accident just happened. Let's analyze it. Let's investigate it. That's good. But risk management is looking forward. So looking at how we systematically analyze risk. First of all, we look at hazards. So there's two kinds of hazards. There's hazards to people. Might cause injury, might cause death. Hazards to things. It can cause damage to equipment or buildings or the organization's function. Like, for instance, let me give you an example of how this works. If the hospital only has one CT scanner, and in certain cases they don't do surgery unless they have a CT scan of the patient, or when the patient comes in with abdominal pain and they can't figure it out, they do a CT scan. Or when they're ready to do a therapy, they do some therapy and then they say, let's see how it went. And they do a CT scan. So the CT scanner is very important. So if the CT scan goes down, there's a real serious risk to the workflow in the hospital. And if the CT scan stops, most of the organization will stop working. So the patients will be sitting in bed waiting for the scanner to be fixed. The patients will be sitting in the emergency room waiting for the scanner to be fixed. So it's a very important device. So we would want to reduce the risk or the hazards or increase the safety of the CT scanner because it would really impact the organization's function. So let's now look at problems that it can occur. So we looked at, it can affect people, it can affect things, but also let's look at problems that can occur. So let's use something simple like mopping the floor in the patient care areas. So there's a housekeeper and they have a bucket and they have a mop and they have clean water with disinfectant in it, and they maybe they sweep the floor and then they mop the floor. So if I'm mopping the floor and the floor is all wet, what's the severity of a problem that can occur? Somebody could maybe just have to walk around the bucket. That's no big deal. If they walk on the wet area and they slip and fall and they land on their back and then their head hits the floor, that's catastrophic. So the risk of having a wet floor because of housekeeping is, it could be very bad, So the severity could be high. Let's look at that same thing. What's the probability? Well, the probability for mopping the floor, if the mop and bucket are there and they're in the middle of the hallway and one side of the hallway is wet and one side of the hallway is dry, the probability of people walking on the dry side is pretty good, but it's possible somebody's not paying attention. Two people walking down the hallway, they're talking to each other, they're not paying attention, and one person could walk on the wet side. So we'd say the probability of walking on that is medium. And then, but this is subjective. So you might say, well, it's higher, but it's okay. As long as we're using the same methodology, we'll roughly end up in the same place. And then the last one is detectability. Can we detect that the floor is wet? If the person is there mopping the floor and the bucket is bright orange and the mop is the person's using the mop and they're actively moving back and forth, then it's pretty obvious that they're working there. However, if the person's not there and the mop is, or the bucket is sort of the same color as the floor almost, you know, for someone not paying attention, it might have a higher scale of not being detectable. So, so if we look at those three components, what happens? We can combine the factors. We can combine the severity, the damage that could be done, the probability that the problem actually will occur, and the detectability of the problem. And we create a numerical methodology to measure and categorize risk. So if we looked at every way, you know, so a person can slip on the floor, a person can trip on the bucket, a person can bump into the person who is mopping the floor. So we can take each of those problems and we can analyze them for severity. What's the chances of bumping into the person? What's the chances of, you know, what's the severity of that? So, all right, so we can then put a number scale to it, and then we can multiply them together to create a risk score. So severity times probability times detectability equals the risk score for that problem. So all right, so that's pretty straightforward. So what we've done is we've turned a potentially unsafe situation into a risk analysis. We've done a risk analysis on it, and we've come up with a way to grade it. So let's look back at the slipping on the floor, the wet floor. Severity could be 4. It could be very severe. Probability might be a 2 or a 3 that it'll happen. Let's just say 2. And the detectability might be 1. You know, it'll clearly detectable if the housekeeper's there. So we multiply those together. So in that case, it's 4 times 2 times 1 is a score of 8. Now, how can we reduce that? Well, suppose the person puts bright yellow signs out in the hallway just in front and behind of where they're working. That makes it much more detectable. That makes you know, the probability less likely if the signs are up. What happens if we don't mop with a very wet mop, but we mop with as dry a mop as we can get? That might make the chances of slipping less, so we can reduce the probability. All right, so what happens is we do this mathematical analysis. We multiply severity times probability times detectability, and we come up with a number that fits somewhere in this graph. I'm sorry, I graded it as a 2-dimensional graph, and then I added the sides to the back to make it 3-dimensional, but you get the idea that low numbers mean it's generally acceptable. Mid numbers mean that it's acceptable considering the benefit. You know, if the floor needs to be cleaned, we just make sure that the housekeeper keeps an eye out for people and says, "Look out." And if it's really very high risk, then we would say it's unacceptable and it's not worth doing. So we need to fix it, make it lower risk. So in that scheme of 4 times 4 times 3, the highest risk score, if I do my math correctly, I think is 64. 16 and 16 is 32. No, 54. So we might say, well, anything with a risk score greater than 30, for example, or it could be 35, means that we take action to reduce the risk. Or we might just analyze the whole situation, all of the modes that things can go wrong, and just pick the 3 highest risks and reduce those. We take action by reducing either severity or probability or detectability. So a risk management process, the risk management process is pretty straightforward. You identify and analyze what could go wrong, risk exposure. You consider techniques to reduce the risk. You select the best method to reduce the risk. And we can reduce the risk by looking at reducing the severity. Like, for instance, a patient falling out of bed. One of the ways to reduce the chances of that, the risk of falling out of bed, is to put up bed rails on the side of the bed. Sometimes patients are delirious and they climb over the bed rails. So one of the ways is, if the patient is prone to be delirious and climb over the bed rails, you put padding on the floor to reduce the risk. Maybe they put a pad in the bed that's an electronic pad that senses if somebody gets off the pad, it completes a circuit, and you plug that into the nurse call system so that if they start moving around in bed, they set off an alarm. So these are techniques to reduce risk, and we select the best method to use in this particular case. We then implement the best method, and then we monitor what goes on, and we try to improve risk management program to make sure that what we did worked. So we monitor what happened, and maybe if it worked, great. If it didn't work, we could pick a different method and go back. So this is just a logical process to go through it, and we've just identified what the steps are. So now there is actually a technique that's called failure modes and effects analysis, and we don't have the time to talk about this in detail, but it's based on the principles that I just talked about. Now, this failure modes and effects analysis is required by many different organizations. So, for instance, when the Food and Drug Administration in the United States allows a product to be used, a medical device to be used on patients in the hospital or anywhere in the United States, they tell the manufacturer, okay, great, you've created this new device, or you're manufacturing a better version of an old device. You need to do a failure modes and effects analysis on all the ways that this device can fail, so that you can either say that the risk is low, or you can change your design to reduce the risk, because we want low-risk devices to come into the marketplace. So another way failure modes and effects analysis is used is, for instance, can you imagine sending someone to the moon? You can't do it 10 times, and the first time it'll fail this way and the rocket will blow up and we lose a couple of astronauts. And the second way, we get halfway, to the moon and we run out of oxygen and the astronauts die. You can't do that. You have to prevent, or you have to identify all the ways that the system can fail, and do your best possible effort to reduce all the failure modes before you send the person up. So NASA, National Aeronautic and Space Administration, who sent people to the moon 50 years ago, they created these big rockets and these space capsules and space suits and all this system that was going to bring them to the moon and allow them to land and pick up some rocks and then blast back up and join the orbiting spacecraft and then go back to the Earth. They did a failure modes and effects analysis on everything, so that they reduced the chance of failure tremendously by looking ahead and reducing. It's such a good technique that the Joint Commission for the Accreditation of Healthcare Organizations, the Joint Commission is what it's called, and the Joint Commission has an international arm called JCI, the Joint Commission International, who inspects hospitals around the world. They say that every hospital has to do a failure modes and effects analysis on some system in the hospital every year, and they have to get a committee together and do this methodology and look at a problem and fix it, and then make it reduce the risk, and then monitor it, and write a report and send the report to the Joint Commission. The way we do this is, first of all, we look at a system or a medical device, and we say, how can it fail? Let me list all the ways of failure. And then we rate each mode of failure for severity, probability, and detectability. And we grade each failure mode, we grade. And then if the score is high, we might do something to fix that failure mode. Like, for instance, defibrillators sitting in the nurse's station that may be used to resuscitate patients who have a cardiac arrest. How can they fail? Well, the batteries could be dead. The cables could be broken. The defibrillator might not work. So how do we, so what's the severity? Well, the patient could die if the defibrillator doesn't work. So that severity is high. Probability, the battery could die if we don't plug it in. The cables could not be working if we don't replace broken ones. So the probability could be high, and the detectability depends, but if you score everything, then you can say, well, these are the major ways that this defibrillator can be a failure, and let's do something about possible dead batteries. So what we're going to do is have the nurses do a little check on the defibrillator every day, and they're going to plug it back in when they're done with the check. But when they start the check, they unplug it, and then they run the defibrillator. Maybe they charge it up and discharge it just to see that the batteries work. And if there's any problem, they report it immediately. And then when they're done, they plug it back in. Now, sometimes the defibrillator can be used and then rolled back to its position. And if the person doesn't know, they don't plug it back in. And then the next time they go to use it, the batteries are dead. So, it's just an example of how you might do a failure modes and effects analysis. So let's look at some examples. These are sort of, examples that I just picked out of my library of bad examples. This is in San Francisco, California. The whole west coast of the United States lies on this gigantic fault line where earthquakes occur all the time. So this is an example of an earthquake that occurred. It shook so hard and moved the ground so much that the road split, and some of the houses slid down the hill. They rocked off their foundations and slid down the hill. So if we look at this from severity, probability, and detectability, let's analyze it. So what's the severity? It could be pretty bad. Particularly, imagine me sitting in my living room reading the newspaper, and an earthquake started, and then my house slid down the hill. That would be bad. I could die. So severity is very high. What's the probability? Well, if I lived in the middle of the country, the probability is 0. If I live in California, the probability is very high. What's the detectability? Well, if earthquakes, they have some indicators that they're coming, but the indicators are only maybe an hour of warning. So if I had if I bought a radio that connects to the National Geophysical Society, who monitors earthquakes and tremors, and had this alarm radio in my house turned on all the time, I might get some warning, so there might be a little detectability, but normally they're not detectable. So how could you reduce the chances? Well, we can't reduce detectability or improve detectability. We can't improve probability, but maybe severity. We could increase the quality of the foundation that holds the house to the wall, to the side of the hill. And to me, that's the only way that you could do that. So it's just an analysis. We're going to do some different examples. Here's an example from, I think this is Egypt. We have a situation here where the merchant put all the heavy stuff on the cart last, and they loaded it at the back of the cart, and the donkey went up in the air. So what's the severity? Well, maybe if this is all glassware, it will all break. If the donkey doesn't come down soon, the donkey could be injured. If somebody was standing near the back of the cart, that could be dangerous. What's the probability? Well, probability is not likely, but here we have a picture of one, so it does happen. And the detectability, well, the heavy boxes versus the light boxes. So if they just had a rule, put the heavy boxes in the front of the cart and load the heavy boxes first, it would have maybe avoided this. But this is a problem that only exists where there are donkeys and donkey carts, and in where the people don't really know how to these principles. Oh, except that's not true. It happens everywhere. If you don't follow directions, if you don't, what's the risk of this catastrophic injury? Now, this is not an injury, maybe, hopefully not, to people, but that plane is damaged. They're going to have to take that plane out of service. The pilots can't fly today. All the contents of the plane need to be unloaded. The plane needs to be carefully assessed for damage. That's an expensive mistake. And it was that they loaded the front of the plane with all the light stuff, and they put the heavy stuff in the back. So all of these problems, excuse me, all of these problems can be analyzed by failure modes and effects analysis, looking at what are the most severe, likely, and detectable problems that could occur, or detectability of problems that could occur. This is the world's worst nuclear disaster. It happened at Chernobyl, and they weren't paying attention. They had some systems out of commission. They were bypassing other systems. They were just assuming everything's going to be fine, the operators. And somehow, some of the cooling pumps didn't work, or the console wasn't able to indicate that the pumps weren't working. And so the cooling liquid to cool the hot nuclear reaction failed, and the nuclear reaction went out of control and heated up and heated up and heated up and melted the whole building. And so what we see here is these concrete pumping trucks with the long nozzles, the long booms, are filling the whole building full of concrete. That's the only way they could contain this. This reaction and spewing of nuclear waste, nuclear radioactivity into the environment would continue for years if they didn't stop it. And they stopped it by filling it full of concrete. But failure modes and effects analysis could have prevented this if the engineers and the managers were looking at, trying to reduce the risk. So here's an example of how complicated the environment is in the operating room. Excuse me. Let me just take this is an operating room, a typical one. There are 3 or 4 people doing surgery. There's an anesthesiologist here. What a complicated environment. How many things can go wrong here? Many, many things. And so by looking at this and looking at where the risks are, what the highest severity, probability, and detectability are, lack of detectability, are you can maybe reduce the risk in this environment. And here's another environment. This is an ICU bed with a patient. This patient's obviously pretty sick, and those are all IV pumps in the background. And there's an intra-aortic balloon pump in the foreground. There's a ventilator here on the right side. There's some other equipment on the left side. It's a very complicated environment. So we use risk management techniques to reduce the risk and increase patient safety in environments like this. So that's the end of my presentation. I guess I started a few minutes late, so I ended a few minutes late. I tried to speed up. So now I'm going to turn it back over